to be really honest, these are sort of things that, as an Indigenous psychologist, I've spent a lifetime, unpacking and understanding. So it's no real surprise to me. But I guess I must say, in relation to the specific report, I get a little bit frustrated by having, heavily promoted reports coming out that make really extraordinary, I guess, claims about the prevalence and rates of mental ill health and self-harm based on what I consider to be quite flawed methodology.
Can you talk to us a little bit about the problems that you have with this study?
Yeah, there's a couple of things. I guess the first thing is that the reports mostly have actually excluded Indigenous people from the actual survey. So they've either excluded them or excluded us, I should say, or they've actually not reported the sample size. So that becomes really problematic, obviously, because we can't actually say to any degree of certainty the extent to which the study is quite representative of Aboriginal people. And that can be quite concerning, because then it really means that we can't be responsive to where the needs really lie, because we don't know the extent to which Aboriginal people participate in the survey, and particularly from regions that we know have very high rates of suicide. Because obviously the earlier we get kids, the more of an opportunity we have to prevent suicides, and that really starts with suicide behaviours rather than the suicide death information that kind of comes out every year, but it's already about 3 years old by the time we get it. And so we can't really be as reactive and responsive to suicide, to addressing suicide risk as we'd like to be.
Then can we talk now about what you believe to be the case in regards youth self-harm and suicide in Indigenous communities, and what services there are for young people who are in trouble?
Yeah, absolutely. Thank you for that question. I think what I know, I did my PhD in the year 2000, which was resulted in the development of the first culturally and clinically valid tool that enabled us to identify Aboriginal youth at risk. And when I say that the current study is flawed, essentially what they're relying on are tools that are very compromised in terms of their cultural validity. So we actually aren't able to answer the question fundamentally, what are the unique characteristics that are resulting in Aboriginal youth having the highest rates of suicide, sixfold compared to non-Indigenous kids? So we answered that question 20 years ago. And what we know is that there are very unique characteristics that Aboriginal kids and adults present with. Now that's critical, because then what that enables us to do is therapeutically focus on the things that we know are resulting in Aboriginal people having a much higher rate of suicide risk. In relation to services, Kirsten, what that also means is that if we don't unpack unique characteristics for Aboriginal people, then we can't ensure that practitioners are trained in accordance with those unique characteristics, which is really critical. What we know is that only 6% of Aboriginal people at critical mental health risk actually access services. Now that's really concerning. We shouldn't have that reality when we have a suicide rate that's actually 6 times the rate of non-Indigenous children.
Given your concerns about this report and its associated findings, what do you think should happen right now to assess the state of the issue and the correct response?
Yeah, I guess what the report does actually say that this belongs in Indigenous hands, and I think the thing that is absolutely the case is that, again, this report did not capitalise on Indigenous expertise in this country. My PhD resulted in data that has not been capitalised in these reports. What I've now done is I've started a charity to develop, and we're about to publish on the first national database, Indigenous-specific database on mental health and suicide prevalence. Now that needs significant support, national support, so that we can have really clear national data sets that actually tell us what's going on in this country with Aboriginal kids. We continue to be excluded from ABS reports, for example. The report that we're talking about today only had one Aboriginal youth in its sample group. Now we have data on 1,200 Aboriginal kids that I've actually collected through self-funding and through my charity, through public donations. So we need that to really drive, the national data sets throughout this country, because quite literally we do not know what's going on with Aboriginal youth beyond the suicide death rate.